is Diagnosis Glaucoma with your hosts, Dr. Mona Kaleem
and Dr. Harry Quigley.
Hello and welcome. On today's episode, we'll be discussing an obtuse subject, the angle. No pun intended there. And actually, they're not obtuse like the angles you had to study for geometry class. These angles go all around your eye and are the basis for understanding how pressure builds up and subsequently damages your optic nerve. There are two configurations of the angle of the eye. It can either be open or closed. In previous episodes, we've briefly touched on the fact that the two major forms of glaucoma are open-angle glaucoma and closed-angle glaucoma. It's important to know the differences because the management of each is quite different. Also, risk factors for getting either type are unique to each. As a follow-up to this discussion, in episode 6, we'll provide information on open-angle glaucoma, and in episode 7 on closed-angle glaucoma. The information we're about to go over with you now will help you have a better understanding of the overall mechanics of glaucoma.
So, what's your angle? That is, what is the angle? And the angle isn't obtuse, it's acute. That is, it's a narrow angle, but some angles are open. The angles where your cornea, sclera, iris, and ciliary body, these are four structures near the front of the eye, all get together. The sclera is the white part of the eye, and the iris is the colored part of the eye. So the angle is really the angle between the wall of the eye, which up front there gets clear, so you can see through it. That's called the cornea, and the iris. So it's the angle between the cornea and the iris. If there's nothing blocking how water gets out of the eye, because it gets out of the eye right there in the angle in a place called the trabecular meshwork. If there's no obstruction to it, if it's actually open to the fluid movement, it's called an open angle. But when the iris is too close to the cornea, blocking the trabecular meshwork, that's called angle closure or a closed angle.
Harry, what you're describing sounds a little bit like plumbing.
All glaucoma doctors are plumbers. We're always dealing with whether the fluid is moving properly, fast enough, or slow enough. Except we don't use Drano or roto-rooters. We use eye drops and surgery. So a good glaucoma doctor won't also spend 5 minutes in the house unclogging a drain and send you a big bill. Good glaucoma doctor is going to spend a lot of time looking at your eye, and the way in which we look at the eye to look at the angle is a special test called Gonea Skippy. Now, if you want to find someone who knows how to do that, you can find a glaucoma specialist at the American Glaucoma Society website.
So we just mentioned the word Gonea Skippy. I'll go over the details of that a little bit more. Gonea Skippy is how we actually take a lens to look at the angle of your eye. So when we look at your eye directly under the microscope and we look straight in, we can't see that angle because it's kind of like a crevice that runs around your eyes. So we have to use a gonioscopy lens, which is a special lens that has prisms in it to look at those crevices. This is done in clinic after placing anesthetic eye drops into your eyes, and the procedure won't hurt. It's a diagnostic tool. But when we do it, you might feel some pressure on your eye, and your eye doctor may actually tell you that they're pushing a little bit. That's intentional on purpose. Dr. Lee Alward at the University of Iowa has done great work in this area and has a website dedicated to gonioscopy techniques. It's www.gonioscopy.org.
Yeah, interestingly, eye doctors learn how to work upside down and backwards. And when we do gonioscopy by the standard technique, we're actually seeing something upside down and backwards. And believe it or not, we actually treat this part of the eye sometimes with a laser, and we have to take account of the fact that when we see it moving to the right, it's moving to the left, and when we see it, it's actually upside down.
Another way to look at the angle, perhaps for someone who cannot tolerate gonioscopy for whatever reason, there are two other methods. There's something called anterior segment OCT, and that's where we actually have a patient sit in front of a machine, and that machine will take a photograph of the angle. However, it doesn't provide the entire anatomy of the angle. It is limited.
I had a lot of fun because I helped the company that makes anterior segment OCT develop that instrument. And the first time we ever saw such beautiful pictures of the eye was really impressive to us. We even can take movies of how that eye structure, the angle, changes from moment to moment. When the lights are on and when the lights are off, the angle changes. But whether it's presently the gold standard or not of how we diagnose glaucoma is still being determined.
Besides the anterior segment OCT, what do you think is a good way to look at the angle?
Well, the ultrasonic biomicroscope is another thing. It's sonar. So for those who are submariners or other things, you know that we can see structures or other things that can be detected by sonic booms that go into the eye painlessly and come back. But the resolution of that instrument is a little bit not as good as certainly as we see, but it can penetrate into the eye better than anterior segment OCT.
Do you think that the anterior segment OCT or the UBM is a replacement to gonioscopy?
No, I don't think any glaucoma specialist worth their salt is going to say that that's true yet, although more studies are being done that show what the value additionally of those tests are.
With the anterior segment OCT, what are some things that we're not seeing that you can see on UBM?
Well, the anterior segment OCT uses light, and light can't go through pigmented structures very well. So the iris of the eye being pigmented kind of blocks your view of anything behind it. Ultrasound passes right through the iris of the eye, so we can see into the interior of the eye better with the UBM or the ultrasound test.
And in your opinion, who needs to have their angles checked? Should we tell all patients to have gonioscopy?
I don't think that most doctors who take care of eye problems in general would be doing gonioscopy unless they suspected that the person had a somewhat higher risk of having glaucoma. And in that case, it's absolutely the right thing to do. And there are a whole list of things that lead somebody to be a glaucoma suspect. And hey, that'd be a good podcast for us. Let's do that next.
Harry, I do have to tell you that sometimes my gonioscopy results differ a little bit from yours. Why do you think that is?
Well, of course, I'm always right. No, stopping our joking for a moment. There is subjectivity to any eye exam technique, and there's room for judgment when it's not wide open angle or extremely closed angle. And in the middle there, I think there's room to not be 100% sure about a lot of things. And I think any patient or any intelligent person would say, well, we know you can't be 100% sure. But if something is 80% sure, if we agree with each other 80% of the time, then that's not such a bad test. And I think gonioscopy is in that range where you can get experts to agree pretty often.
Gonioscopy is a very important part of the examination, very important for diagnosis. And although we have technology to look at your angle, still not quite as good as the exam with the gonioscopy lens.
I have patients who I've taken care of for 15 years, and they will ask me, Dr. Quigley, I never asked you, do I have open angle or angle closure glaucoma? Because I've been asked to take this medicine. It's a pill, and it says on it, do not take this without asking your doctor if you have glaucoma. And some of those pills you shouldn't use if you have angle closure type glaucoma, but you can use them if you have open angle. So I think it's very important for all patients to know which type of glaucoma they have. Ask your doctor if you've had gonioscopy.
For everyone listening, you just heard it from the experts. Go ahead and say yes to the gonioscopy.
Thank you for joining us. Until next time, your mom says take your drops.